Welcome back, friends, to TV5 News at 9. Joining us this morning, real treat, registered nurse Rebecca Willard from the Saginaw Co Health Department. How are you, Rebecca?
I'm good. How are you?
I'm doing well. Thank you for being here. We appreciate you coming. So we are talking today about safe marijuana usage. So what does it mean to use medical and recreational marijuana safely, and what is the health department doing to educate the community about this?
Absolutely. So even though marijuana is legal, there are still things that people can do to make it safer for themselves and those around them. So at the health department, we have a new digital ad campaign called Always Safe that's meant to educate the community on some of these strategies. So that can be things like it is still not safe to use marijuana if you're pregnant, if you're breastfeeding, or while driving, and that it's important to make sure you're storing marijuana safely around kids, pets, or adolescents. So to help with that, we are giving out free lock boxes, bags, or locks at the health department, and if people are interested, they can stop by room 101 to pick one up.
Perfect. A lot of great tips. That's very helpful for the community. Thank you for that. So for those of us who live and work in Saginaw, we've seen these beautiful art murals on the side of the health department there. So tell us, when was it painted and why is the health department doing this for harm reduction? How is it really educating the community on that?
Yeah, so harm reduction is basically anything that we do to reduce harm of a negative behavior.
That's gorgeous.
So in public health, we use that a lot. It can be
Yes.
things as simple as using sunscreen to reduce the risk of sun exposure. So harm reduction when it comes to drug use
Yes.
is anything that any strategies that are used to reduce the negative associated consequences of drug use. It doesn't minimize or ignore the harm that drug use can cause, but instead it focuses on improving health of that individual and meeting them where they are. So not only is this mural a beautiful piece of art, but it's also really given us the opportunity to focus on recovery, addiction, and to introduce some of these concepts of harm reduction.
Oh, wow, that's so interesting. So I've heard the health department, you guys are doing so much there. What else? We've heard of a new clinic that you have, room 202.
Yes.
Tell me about that.
Yeah, so room 202 is a new addition to our public health services. So it is meant to be a judgment-free place where people who use drugs can stop in and get clean syringes, fentanyl test strips, Narcan, and other necessary supplies for either themselves or others. The goal is to reduce the prevalence of HIV and hepatitis C in our community. So Saginaw has the 9th highest prevalence of HIV in Michigan, and this is just one tool that we can use to help reduce that.
Yes.
So the plan is to be open on Tuesdays from 9 a.m. until 3 p.m. Lots of different members of the community have come together in preparation of this to get the Saginaw City drug paraphernalia ordinance changed so that it now aligns with the state and that there's an exemption for people who are using these services. So you'll get an ID card if you do use these services to show that you are participating. We're also really excited to announce that we are going to get a Narcan vending machine that will provide people in the community free and easy access to Narcan, which can help either revive and stop death for somebody who's experiencing an opioid overdose.
You are really looking to help take care of everyone in the community.
Absolutely.
I love that. So is there ever a concern when you educate people about drug use that it's going to increase drug usage? Is that a problem?
Harm reduction isn't without controversy, and that's definitely a concern people have. The research, though, is pretty overwhelming that teaching people to use drugs more safely does not increase or lead to more drug use. What it does is help keep that person's health in a better place and also for the community. Also, people who use services like Room 202 are 5 times more likely to access recovery services than those who don't.
Oh, wow. That's a great stat.
Absolutely.
Okay. So what does it say about Saginaw that we have these wonderful services available at the health department?
Saginaw is currently ranked one of the least healthy communities in the area. So being able to learn from other communities and the things that they have tried and implement those successful strategies in Saginaw is really important, and it's been so encouraging to see so many different members of Saginaw come together. These last few years, we've really seen the community come together to focus on health and really encourage everybody in Saginaw to be well. So if people are interested in more information, they can go to saginawpublichealth.com or bewellsaginaw.com.
Well, you're jam-packed there in the health department. We appreciate you. Thank you for all the work that you're doing.
Thank you.
Yeah, we appreciate you coming in today. You can find more information in the hot link section of WNEM.com. Stick around. Matthew has a look at your sunny forecast after the break.